don't understand is that people don't know the anatomy of the private sector. The private sector doesn't have doctors. A hospital group, Netcare down the arm, it doesn't have doctors that belongs to them. It's private people, like it's private doctors who run their own private practices independently of one another and without cooperation, without anything. So they just, like you made an example of an accident, an orthopedic surgeon, it means he's the one on call or he's the one who's closer at the time. Or he's the lucky one that will be called by the casualty officer when the patient arrived in casualty in that private hospital. So in essence is that there is what the truth to what the findings of the commission says is that there's a lot of moral hazards to it, and there's asymmetry because also people can't measure the quality. So then they can measure the quality in the health sector in public because they entered para casualty and it looked like a war zone. That's what they normally write on Twitter. You know, it looked like a war zone and all that, but they were able to get prompt response. Orthopedic surgeon was not called from home, they were there. You know, theater was available at that time, at that point. You know, and in private you have to look for the anesthetist there, the anesthetist is there, you know. So in terms of response, and I think it's one thing that the commission has said now, that maybe we need to talk about our strength, you know, and we don't talk about strength most of the time. But the conditions that we can set, we can't set a condition on a private hospital group because they don't have doctors. You know, even casualty is almost privatized. It's run by another person who runs it independently of Netcare. You know, it's his private practice, you know, and he's charging it. So there's just a lot that people don't understand about private, and sometimes as a person who also had a stint to work in private, people don't understand the extent of poor quality of service that happens, you know. Single person decides at that point, you know, in public, you have to account to a prof, you know, in the morning after we have done a female repair, you know, that no, then the prof will say, but you must go back and redo this because you have screwed in the wrong space, you know. In private, there's nothing like that, you know. No one gets peer review. It's only now that they're trying to do that, but it's something that we have to. So I think the conditions would be that they have to get themselves organized in a way that they become one body, you know, and they can function as a hospital and we can be able to get a service that is, you know, accountable. But at the current juncture, I don't think we can be able to do that. But maybe with NHI, which I'm hoping, for me, is that we are pioneering this thing. You know, we'll see how it goes with this weekend, how we're going to utilize Mill Park. You know, Mill Park Hospital here, it's a trauma hospital. But usually the first point of contact and first point of landing is our hospitals. Charlotte Makleke or Chrisane Para. Immediately when they hear that RAF might take care of you, then you're flown out to Mill Park, you know, and I'm not sure if we can be able, you are flown out only because you're going to get a better hospital service or hotel services in Mill Park than the actual quality of care.